Quebec is experiencing the highest COVID-19 death rate in the country. In mid-January, the average death rate per million within 7 days was nearly double that of Canada's total death rate. During the same time, Quebec's death rate was also higher than Italy, the United States, and the United Kingdom. So how is this affecting the homeless population in Montreal? Some shelters are facing outbreaks, not just among their clients, but among staff as well. Over the holidays, 27 shelters reported outbreaks in Montreal. Staff at homeless shelters have been discouraged by what they see as overpolicing and an otherwise apathetic government response. Homeless people are turning to mutual aid in greater numbers to survive the pandemic. This is being done through volunteering to serve food or help out staff in any way possible to keep the shelter running, as COVID has resulted in staff shortages, as both staff and clients are getting sick. Outside the shelters, temperatures have dipped into the -20s and -30 in recent weeks, making the outdoors a much more dangerous place for the homeless to sleep. In January, a 74-year-old homeless man froze to death on the streets of the NDG Côte-des-Neiges neighborhood. 10 days later, a 64-year-old homeless woman died amidst freezing temperatures near Barrie-UQAM station.
Yesterday and all the days before, there's been shuttles and the SPVM that are patrolling everywhere to get people in a shelter.
In this episode of Local 514, I'll be covering the difficulties that homeless people and shelters are experiencing during the fifth wave, and how a grassroots movement has been created at some shelters due to gaps in support. David Chapman, Executive Director of Resilience Montreal, says half of his staff has COVID.
At a time like this, you have to ask really hard questions. You know, like one of the agonizing questions we've had to ask as an organization is, who do we prioritize? We were closed for a few days after Christmas, and we were due to open up on the 3rd of January. At the same time, we had a growing number of COVID cases, where we had around 6 COVID cases among the staff. And I had a number of staff saying to me, you know, I don't think we should open, because this puts the staff at risk. And they're absolutely right. It does put the staff at risk. We stayed open. On my way into work, in the alleyway behind our building, it's -18, and there's a homeless guy sleeping out there with just a jacket, trying to get near a heat vent. And I can tell you, he was pretty happy that we were opening. So the question, here's the hard question: whose rights get priority? The staff and their health and safety, or the most marginalized population, the actual homeless who don't have an apartment and a salary? And you have to choose.
Homeless shelter The Open Door is also experiencing the weight of Omicron.
More people are getting sick all at once. We have COVID testing like at least twice a month. More recently, we've been having it every week. Before the Omicron wave hit, we had several months consecutively with 0 positive cases. And since this wave hit, we've had multiple users sick, as well as staff at the same time.
2 emergency hotels have opened for COVID-positive homeless people to isolate in, as well as a stadium. Recently, Projet Autochtone du Québec moved its services to Montreal's Hôtel des Halles, where it now provides 50 emergency beds to homeless Indigenous Montrealers. Formerly, their services were only open overnight, but it will now be offered 24/7. The Native Women's Shelter was able to avoid outbreaks because they stopped accepting new clients in December as Omicron hit Canada. Naguset, Director of the Native Women's Shelter Montreal and volunteer at Resilience Montreal, says the city provided more during the first wave compared to now.
During the first wave for the Native Women's Shelter, when we had to close the shelter for 2 weeks, there was a designated hotel by SOS Violence Conjugale that was for women and children. So when we closed down, we sent all the women and children there. And upon reopening, they came back. Now that hotel does not exist anymore. That service does not exist. I'm not exactly sure why, when the 5th wave arrived, that did not spring back into action. So it's not a really good time for families. Like if they get COVID, it's panic. Where am I going? Where am I going with my kids? There were a lot more hotels that were designated for the homeless population and also for, women facing violence. So I think that when they started lifting measures, when we started getting out of the red zone, that's when the government started closing all these hotels.
Chapman says that the government is not helping out with what resilience truly needs.
The government will help. They'll send public health to come and police us all. But they won't send staff to keep the Raphael Andre tent open or to keep Resilience Montreal open. And when they do send money, it won't be that much. And so, generally speaking, the government can be pretty frustrating because they'll come to police you, but not to help you. And that can get really tiresome. The sort of help you get from the government is often very slow and often not what you actually need.
He says the gaps in support have led to a grassroots movement at Resilience, as some of the clients who use the services have stepped in to volunteer.
I've had a lot more volunteers lately among the homeless community who are pitching in various ways to help out. And that's a really exciting dynamic to see, where you have like almost like a grassroots movement occurring among the homeless, where they're saying, okay, the government's going to screw us, but you know what? We're going to look out for each other. And that, you say, well, there still is some humanity in this after all.
Clients volunteering is not new to the Open Door, as coordinator John Tessier says some clients that use the services often step in to help. Yogi, who has been using the Open Door services for the last 4 to 5 months, also volunteers to help the staff and services at the shelter.
Since the second day I was here, somebody asked if anybody had ever worked in the kitchen before, and I had worked at a senior's home in the kitchen. So I said, hey, I'll give a hand. I've been in there for like 4 months. But I've been also staying here, so I returned the favor because now I have a place to stay. It's give and take, They give me a place to stay, and I give them all the help they need.
Despite clients helping out, the need for more staff is still vital.
The cook tested positive, and we didn't have a volunteer. So sometimes one of the intervention workers, sometimes it's me, since I'm the team leader, I have to go in the kitchen and we had Yogi, because Yogi is not cooking, it's just about serving. But as intervention worker, even if you're in the kitchen, your mind is on the floor. If you, like, someone's yell or stuff, you have to run and come here and, oops, I forgot something in the kitchen, I have to go back there. Like, by the time the co-workers calling the police and stuff, yes, or someone's yelling. Because sometimes people are in crisis just because, yes, mental problem, but most of the time just the trauma and stuff, especially for women, drug dealers, someone's forcing him to do the prostitution and just all of that. Like the alcohol problem, and so, like I said, this the therapy is closed. When you have to do both at the same time, yeah, that's difficult. Yes.
Staff shortages aren't the only issue, as there is a need for more space to house shelters. What was once a homeless population of 2,000 pre-pandemic has doubled to 4,000 homeless people on the streets of Montreal.
When it comes to homelessness, it is a mandate and a responsibility of the government of Quebec.
Across the street from Resilience Montreal is Cabot Square, where the Raphael Andre warming tent rests to provide warmth and free meals to the homeless. The tent is named after Raphael Andre, an Innu man experiencing homelessness, who froze to death in January 2021, less than 2 weeks into the first curfew. Naguset says the tent holds 15, but often 300 people are showing up each day to use these services.
What we need is a designated spot to refer Indigenous women and their children. That doesn't exist. That is our number one need. If someone gets sick with COVID and their children do too, where do they go? And it needs to be created now. I mean, you have to understand, we have women that are designated with their children by youth protection to the Native Women's Shelter. If we send them elsewhere, we have to call youth protection. What if they're like, well, we don't approve of this spot, so we're going to take the kids? right? Like it's not easy. So if the government just designates this spot as women and children, then it'll be easier for Batshot to allow these kinds of things.
She says the city was requested to find a permanent space for the tent since April 2021. However, a space has not yet been provided. Since before the pandemic, there have been calls to provide reduced rent housing to decrease homelessness in the city and the province. But for some, this is not always accessible.
My welfare was cut, and I was at the Salvation Army, but the rent there was $5.20, and I wasn't getting that much income, so they basically asked me to leave. I went to the Old Brewery Mission. They were full, and they sent me here. I've been here ever since.
So what other needs need to be met?
Two of the main things that people on the street struggle with are addiction and mental health services. If we doubled, tripled, quadrupled the mental health services, programs like PRISM, programs like SII, which Suivi Intensive Itinerance, we can help a lot of the people before they become homeless, or once they're homeless, give them a place to be with support, with dignity. Last year when Raphael Andre died, all of a sudden, after he died, everyone scrambled and they made a tent at Kevin Square, and they, at the time, they were making us close at 9 o'clock, then they allowed us to stay open 24 hours, and they started scrambling after the tragedy. Why does it take the tragedy? Let's just, there's obviously a need. Let's not make this emergency funding. Let's not wait till there's a tragedy that happens to scramble and do something about it. We know that every winter people freeze to death outside. We know there's a need for long-term stable housing. Let's work towards that now.